will worry most about embarrassing odors. The client with an ileostomy, because it's high in the bowel and not everything is digested. Which client is at greatest risk for skin irritation? The client with an ileostomy, because the digestive juices are right there and can be irritating to the skin. During the preoperative period, it is important to provide emotional support to the client and family. It is helpful to have the client visit with a person who has successfully undergone ostomy surgery. The United Ostomy Association provides trained visitors who can encourage the client. In addition to routine preoperative preparation and teaching, the nurse, ideally a stoma care nurse clinician, assesses the client's ability to care for the stoma. The nurse also evaluates the client's available support systems, as well as any problems that the client and family may encounter following the surgery. To prevent postoperative infection, the client's bowel is prepared prior to surgery. Erythromycin, neomycin, and osmotic lavages are administered orally to cleanse the bowel of feces and bacteria. In addition to standard postoperative measures, the nurse assesses and cares for the stoma, protects the skin around the stoma, and ensures proper fit of the pouch or ostomy appliance around the stoma. Also, be sure to instruct the client in ostomy care and diet modifications, and provide emotional support. The overall goals for a client who has undergone ostomy surgery are to become self-sufficient in caring for the stoma and pouch, to regain independence, and improve self-image. It is important to assess the client's mental attitude toward the stoma and self-care before beginning instruction. You should not force a client to look at the stoma or perform self-care procedures until he indicates that he is ready. To help the client achieve self-sufficiency following stomal surgery, be sure to provide clear instructions. Demonstrate care of the stoma, basic pouch care, and colostomy irrigation as appropriate. Discuss dietary modifications, how to order supplies, and community resources. Prior to discharge following ostomy surgery, provide the client with the following instructions. Inspect and clean the stoma and empty the pouch daily. Store stoma care equipment in a container in the bathroom. Equipment includes a pouch, scissors, tissues, soap, towels, washcloth, and a bag for disposal. Because the stoma will decrease in size over the first year, measure it 3 to 4 times a year to make sure that the pouch fits properly. Thoroughly wash hands prior to and after changing the stoma appliance or pouch. Inspect the stoma and the skin around the stoma carefully. Look for signs of bleeding, irritation, skin breakdown, swelling, and redness. Report these problems to the primary care physician. Empty the pouch into the toilet when it is 1/3 full, and rinse it with clear, cool water. It is usually necessary to empty the pouch about every 5 hours. Clean the area around the stoma with non-irritating soap and gently pat it dry. Apply a skin barrier such as a liquid or spray skin sealant. Once the sealant is applied, place the pouch over the stoma and press it down on the skin for a few minutes for a good seal. Change the pouch about every 5 days. Report constipation or diarrhea to the primary care provider. Eat a regular diet, but avoid gas-forming foods and drinks. Gradually add foods containing fiber to the diet. Which foods should a client avoid to prevent obstruction? Following an ileostomy, the client should avoid nuts, raisins, popcorn, seeds, raw vegetables, celery, and corn, because they can cause obstruction. Assume regular activities within 6 to 8 weeks, but avoid heavy lifting. Which client might have more difficulty with sexual relations? The client with an ileostomy, because the bag is right in front. The client may also be embarrassed about odors. It's important to discuss and educate the client about potential sexual feelings and activities. Supply a contact, such as the United Ostomy Association, for additional information and support. Diarrhea is a general term for an increase in the number, amount, or liquid content of bowel movements, as compared with the usual pattern for a particular person. Diarrhea is not a disease in itself, but it is usually a symptom of another medical condition. Diarrhea develops when intestinal motility increases, and the intestinal contents are propelled rapidly through the colon, with little time for absorption of water and other substances. The result is stool that is loose, runny, or watery, and the need to expel it is usually sudden and urgent. Many people experience abdominal pain or intestinal cramping with diarrhea. There are many causes of diarrhea. They include intestinal infections due to
Escherichia
coli or Vibrio cholera, food allergies, lactose intolerance, intestinal disorders such as diverticulitis, ingestion of very spicy foods, overuse of laxatives, side effects of medications such as antibiotics, intolerance to tube feeding formulas, a rapid increase of fiber in the diet, inflammatory bowel diseases such as ulcerative colitis, Crohn's disease, and irritable bowel syndrome, and recent travel to an area where drinking water might be contaminated. Part of your assessment of a client who has diarrhea is monitoring the volume and character of the stools. Measure liquid stools to assess how much fluid the client is losing, as well as the risk that the client may become dehydrated or develop electrolyte imbalances. Check the stools for pus and for blood. Also, palpate the client's abdomen for distension. Place your stethoscope on the client's abdomen and listen for bowel sounds, and examine the client's perianal area for redness and excoriation. Be sure to weigh the client every day and take vital signs. Notify the healthcare provider if the diarrhea persists or worsens, or the client reports acute abdominal pain, is losing weight, or shows signs of dehydration. Now that we have discussed the causes of diarrhea and how to assess the client, what about management? The nursing diagnoses for clients who have diarrhea are diarrhea related to altered frequency and consistency of stools, pain related to abdominal distension and cramp,